if you ever see your husky with a blue, red, whitish eye, immediately go to the vet. Inflammation of the eye. Generally, disease escalation is fast.
If the dog goes blind, like, do they have the good quality of life still? Are they struggling?
This is killing me. Okay, never use steroids in kittens. Okay, this is like a rule 1 of ophthalmology 101.
Don't do this.
Yeah, definitely.
Hello, and welcome to another episode of Tea and Tales, where we talk about vets, pets, and share a cup of tea. I'm your host, Megan Taylor, and today with me is Dr. Tatiana. Welcome.
Thank you so much.
And today we're going to speak about ophthalmology and the eyes. Can you give us a little bit of background about yourself and why the topic is of such interest to you?
Right. To be honest with you, I've been in Dubai for 10 years, and ophthalmology in animals is not so common in here, I would say, right?
No,
there was
not
only a
at all,
couple of ophthalmologists. They were not so, they were not in-house ophthalmologists. They were visiting specialists. And these days, there are a lot of pets. People really care about them, and they want top-notch care, right? And therefore, ophthalmology becoming bigger now, right? And we have microsurgeons now, and we do genetic testing. We do like insane and cool stuff now, right? And of course, just general care increase, like in every other field, right? We want best.
Yeah, it's advancing so much, the veterinary care always.
Definitely.
So can you tell us a little bit about why eyes matter so much?
Why eyes matter? Look, the thing is that obviously we do understand eyes are very important because it's a vision, right? And especially for animals as well. In general, eyes are quite sensitive. And in my practice, very often when animals get sick with eye issues, they escalate quite fast.
And do you know why that is? Or is that because it's one of those things where people aren't coming in till it's like on the brink of being a big issue?
Honestly, it's difficult to say for sure. I believe generally, like if animal gets an infection or let's say some high pressure in the eye or inflammation of the eye, generally disease escalation is fast, like with dermatology, you can wait, maybe observe it for a week. With the eyes, sometimes within a couple of days, it's like from bad to worse, So this might be an issue as well. I wouldn't say people are not seeing it because this is the thing you're actually seeing, right? When you look at your pet. So I believe it's just the disease process, right, is maybe a little bit faster, right? But it's a bit subjective, obviously, And
what are some common issues you see when people come in with the eyes? What are the kind of the main ones people know about?
Cats, dogs.
Oh, okay. Give us cats first.
Cats. Then. Okay. Cats, mainly we see a lot of kittens below, like, let's say 1 year old and sometimes up to 3 years old with a lot of viral conditions in the eye. This is super common, especially in Dubai.
So stray cats as well.
Stray cats, you would walk somewhere, in Deira or somewhere, in your area, and you would see like hundreds of cats and a lot of them with eye discharge. And mainly it's viral plus bacterial, together. But the main cause is the viral infection, like herpes virus, calicivirus, because, it's a big colony, it spreads fast. In house cats, it also exists. They can bring it from the street. They can bring from a kitten you just brought to your house or you went to your friend.
So these viral infections are still, affecting house cats.
Yeah, definitely. I see a lot of house cats with viral infections, mainly young, because immune system is a little bit weaker, etc., right? So in cats, mainly viral, to be fair.
Okay.
I mean, they have all the rest of the things, It's not like it's non-existent, but if you take a big chunk, it's this. In dogs, it's mainly bacterial, like conjunctivitis or some ulcers from scratches, fights, etc. So, but this is, there are hundreds of diseases, right? This is what we mainly see, but we see a lot of like niche things as well.
Okay. And it's funny that you said it's mainly conjunctivitis because I feel like anytime anyone has a problem with their pet's eyes, it's conjunctivitis.
It's always conjunctivitis, right? It doesn't matter. And then, it's really funny and sad, okay? Because people come, they're like, my dog had a conjunctivitis for a month, and I tried A, B, C, right? And it's glaucoma, and we are...
So you often seeing it misdiagnosed?
Yeah, unfortunately, sometimes sometimes people want to see and wait, right? They're like, there's a little bit of discharge. Let me use chamomile, or warm water. I will just flush it. I'll see how it goes. And sometimes really, if it's just mild bacterial infection, sometimes just cleaning
That's
helps.
enough, yeah.
Sometimes they need an antibiotic or something additional on top. But very often, if it's something which, doesn't pass in 5-7 days, obviously you need to go see somebody. And very often it requires, more proper treatment or diagnosis of like a correct diagnosis when it's not a conjunctivitis anymore. It's something
You need to
beyond
understand what it is.
conjunctivitis, yeah.
Well, that's the next question is, what is the kind of difference of going to see your general vet and then like kind of doing an ophthalmology checkup with like an ophthalmologist or like an ophthalmology exam?
Well, first thing, sort of plan your day appropriately because ophthalmic exam takes up to 1 hour.
Okay,
And
so talk us through.
You need to be really prepared for that because some people come, in a rush before
Okay,
work.
5 minutes quickly, look in the eye, tell me what it is.
It doesn't work like
Yeah.
that. If we do full ophthalmic exam, right? If we do full ophthalmic exam, it would include, we will check the reflexes, we will stain the cornea with a special stain called fluorescein to see if there's any ulcers. We'll check eye pressure. We will check what's inside the eye with the special machines we have. We'll check the retina, the backside of your eye, if it's a full ophthalmic exam. But in order to check retina, you need to dilate the pupil to open sort of
Right.
a window, right? So you're able to see the retina because it's on the back of the eye, and we have like a special machine. We can look into the eye, and you basically see what's inside, right? And that pupil dilation process, just to put a drop and wait until it dilates, 20 minutes,
Yeah.
So obviously plan it accordingly. It's about an hour. Sometimes you don't need full ophthalmic exam. And really it's something, something superficial, let's say, right? Or something with the lids, right? And people are like, this is still a eye exam, right? But it's an eyelid problem, not a eyeball
Different.
problem,
Yeah,
right? So sometimes you don't need to see a retina for that. But if you do go see a specialist or you want like a full ophthalmic exam, it does take around 40 to 60 minutes on average. Depends, on the demeanor of an animal, how scared it is.
Is it ever sedated or it should always be done awake, or how is that usually kind of if
Interesting.
they're anxious pets? How do we do this?
Interesting. I don't remember last time I was doing a sedated exam, to be honest with you. It's very rarely we have to do it. Most animals we can, agree with, right? With the treats.
Of course.
Or with just, owner standing and saying, Bella, you're really good. You're doing
You're
really
doing
well.
amazing.
So this is what we had yesterday. The owner was standing. The dog was completely anxious, while we were trying to check at the beginning. And then the owner started talking to her, calming her down, and she really settled, So sometimes, like most times, it's like this, and we manage. So
And most of the time it
yeah.
wouldn't be overly uncomfortable either for the pet. It's a lot of like in your face and so on, but is it uncomfortable parts of the exam?
I wouldn't say it's painful, but it is a little bit uncomfortable because animals don't understand what we are doing and we
Yeah.
are doing something to the eyes,
Yeah.
And like they can actually see that we are doing something to the eyes, right? It's easier with the ear or let's say a skin or a leg, right? But in here you're doing something where they directly see it, so they get a little bit scared, right?
Yeah.
But if you do it gentle and, we're also doing it for years, we already learned some techniques how to do it nicer, right, to them. So mainly we can succeed with most of the animals, even anxious ones, with no sedation. But I did have a Cane Corso. It's like a huge dog, like a 55 kilogram dog. And we did have to sedate the dog because it was extremely difficult for a handler to hold it. And it needed like a full exam, So this dog was sedated, but this is the first dog in years I had to sedate.
Yeah, I
for
never
an
hear
exam.
about them sedating. Yeah.
It's very rare.
And can you give us an example of when an eye exam kind of uncovers a much bigger health issue, or a few examples of that?
Often. It's very often.
Yeah.
Okay. Very often I get animals for eye exam and we find, that the reason is actually not eyes. Let me tell you my favorite cases, okay? I had a couple of favorites, okay? I had this little French bulldog, Winston, super cute, long-time client of mine. And the dog had issues with eyes in past, a lot of issues, ulcers, non-healing ulcers, etc. And then suddenly she noticed the eyes again looking funny, he's struggling a little bit, etc. And then she's like, again, ulcer, and the owner is the sweetest, and she's very due diligent. She always brings him in for a checkup when she sees anything wrong.
Okay.
And then she comes in and we are checking the eye and I'm realizing, yes, indeed, there is an ulcer, but the dog lost sensation to half of its face.
Wow.
Okay. And then
So the owner is kind of seeing him squinting, but it's not like squint. It's
at the beginning,
nerves.
it was, he still had a little bit of sensation and he was squinting, and then he stopped it because he literally cannot blink,
Yeah.
there is no innervation in that part of the face. And turned up he had a meningitis, which is a
Wow.
life-threatening condition, due to inner ear infection, okay? And it affected the eye through the nerves, right? And this is where the, eyes become not eyes, right? It became neurology problem. And honestly, the fact that she was so good and she's like so attentive on his eyes in general, from past experiences, probably saved his life, okay? Because meningitis is, prognosis is, uncertain in many cases. And he's alive and well, and his photo is in my wall in my house, because she gifted me a little photo of him. Yeah.
That's so
He's
sweet.
a very sweet boy, so I see him every day, when I wake up.
Your inspiration for the day.
It's a very nice case, because, it's very sad for a dog, to be honest. But it's a nice client, nice case. We diagnosed this, thanks God, on time, and it saved his life. Okay,
Yeah.
because he has a very good owner.
This is why it's so important if you see these small things, which is another thing. So what can people look out for then? What are those small signs where it's like probably don't sit and wait and watch that get worse?
I prefer to divide always cats and dogs, okay, because the eyes are a little bit different, the conditions they have. In cats we have a lot of cases with, let's say, watery eyes, right? For example, the cat comes, the eyes are a little bit watery. If we talk about, let's say, a Persian cat, and it's the issue from birth, and he's 4 years old, right?
Persians and their eyes,
Yeah, there is some sort of skull, brachiocephalic animals, right? When the skull is a little bit flattened, very often the eyes are a little bit out. They're not entirely in the socket, and that sometimes causes tearing or issues with the nasolacrimal duct. So in those cases, when it's 4 years of just tearing, it's obviously not so urgent. But if your cat was never tearing, for example, and then suddenly started, you better see an ophthalmologist or your GP, to at least check, right, at the beginning. If you see any redness in the eye, like the eye looks red, also I would say it's a reason for a checkup, or there is like a mucus or purulent discharge in the eye. If you do see your animal is doing like this, trying to close one eye, or sensitive to light, and for example closing and trying to slip it off, right, so it doesn't need to keep it open, most likely your animal is in a lot of pain, and eyes really hurt much, so it's best in that case to kind of rush a little bit, right. In cases of if it's a little bit watery but looks okay, no signs of pain, maybe it can wait a day or two, but overall, pain is the most, the worst thing to have, and especially if it's a long-term something. So obviously when you see any like signs of blepharospasm, we call it, right? When they close the eye as a reaction to pain, or any like sudden redness, or the eye turns a little bit bluish, anything like that, then you definitely should see an ophthalmologist or GP at least to check your cat, as a first opinion, as soon as you can, and a dog as well. Sorry.
So what were they? Sorry. What were they for the dogs then?
For the dogs, there are certain breeds, which are a little bit different, okay?
Yeah.
Practice showed that brachiocephalic breeds like Pugs, French Bulldogs, English Bulldogs, they're extremely tolerant to pain, and they're very prone for corneal ulcers. And very often, at the beginning, they won't show. Like, literally, the dog won't show.
Very stoic.
And then, very stoic dogs in general. So at the beginning, owner would not see anything, they would be like, my dog is a little bit off, maybe sleeps a bit more or something, right? And then after some days, once it gets worse or, infection catches up to it, etc., then they would notice a discharge or something, and then they would come in, right? So in case you see something like any signs, try to examine yourself for any abnormalities, like if you see anything on the cornea itself, on top of that, if there any discharge, again, try maybe to lift the lid a little bit, see if the eye is red. So just be careful with these signs. And of course, there are certain breeds, which are
That's what I want to get into.
certain things.
What are the breeds, people? Because I think it's so important for owners to be aware. I have this kind of breed. I need to know.
You have this kind of breed.
I have, I was going to say, we have our Shih Tzus.
Yes, exactly.
They are prone, but what other breeds can people be aware of?
Look, for example, Husky, okay? Husky have predisposition for primary glaucoma. Glaucoma is elevation of the pressure in the eye. It's basically you have this liquid in the eye, which is supposed to drain from the eye. And in this breed, this drainage canal, let's say, it's getting closed, right? For different reasons, right?
Okay.
Let's not get too medical into it, right? So in Husky, if I always tell it to client who even comes for vaccine, imagine they come for vaccines, and I always say, if you ever see your Husky with a blue, red, whitish eye, immediately go to the vet, because literally you have like maybe 4 to 6 hour window to save a vision, okay?
Wow.
Because they're very predisposed.
We had Dr. Christine here 2 weeks ago, and she was talking about Huskies and epilepsy and how they don't respond that well to the medication.
Oh, man.
Did they also not respond for that? Is that just a Husky issue that they're not responding well to medication, or this was just an epilepsy?
No, there is the guide. There is actually a guide where you can write the breed, and it shows you their genetic predisposition to certain ocular conditions. Okay, we can put it maybe.
Where can people find this guide?
Yeah, it's online. It's available for everybody. Maybe we can put a link down below or something like
let's
this.
Do that.
In case you are curious, right? What my dog like? What is it that I have to look for, right? Because we cannot discuss every breed right now in
we don't have time for that.
Yeah, exactly. Okay, but for example, Husky, right? Coming back to our favorite bulldogs, they're very, very much predisposed to ulcers because of the skull constitution, right? Because it's a little bit flattened face, the eyes are a little bit out. So, they are prone for traumas. They're, again, stoic dogs. They like to play fight strong, etc. They have a lot of skin allergies and they start rubbing the eyes. That's also causing an ulcer. So these guys are, ulcer candidates in most cases. Huskies with glaucoma also very common. Who else is what's interesting? Oh, you have this huge fashion now for mini poodles and Maltipoo.
Yeah.
Right? And they have a lot of watery eyes. So this is also very frequent reason of a consult. Very often there is no much medical condition behind, Sometimes there is a problem with the tear drainage and we can flush the canal to try to improve the tear drainage. But very often it's just, rather dermatology condition than ocular.
Actually, okay.
Yeah, but this is something the breed has, commonly. What else?
And is it Cavalier? Are they?
Cavaliers, yeah.
Yeah.
This is my frequent client as
I
well.
was going to say, I feel like I always see Cavalier for the dry eye.
Dry eye, you're right. You're absolutely right. Cavaliers are not been genetically lucky, heart disease, allergies, like skin issues in general, and eyes is part of it. They very often get this condition called dry eye syndrome, right? And dry eye syndromes, it's basically when they don't have enough tears or the tear quality is wrong, And most of them, they need to be on a lifetime supplementation with medicine to improve quantity or quality of tears and plus lubricate the eyes, Otherwise, it looks quite bad and eventually causes vision loss or reduction in vision.
And for this, is it quite a simple test to do?
Yeah, super simple test, actually. People get a bit scared of it, okay? Because it's basically like a little paper strip, and you need to take this paper strip and put it under the lid for 1 minute and see how much there is like it's a lacrimal strip, right? You put it in and it stains with a tear to a certain level and there are numbers there. So in a minute, the animal should produce 20 millimeters of tear in each eye. If it's less, it's a dry eye. This is to check for a quantity, right? And also there is qualitative. When your tear contains of different components, and if you want to check for the quality, you put like fluorescent stain and see how fast it disappears from the cornea.
Well, these are pretty simple tests. So it's kind of like if you have this breed where it's prone, like the Cavalier, like it's not a bad idea to be kind of running this semi-periodically just to keep an eye on things.
Yeah, definitely. You can do it during a vaccine, it takes a minute.
Exactly. It was quite easy. So we've already spoke about the kind of difference between the general vet checkup and the ophthalmology exam. So what are some of the biggest myths that owners have about their eyes that you commonly see people have like this misbelief or this kind of concept in their head?
It's difficult for owners to understand that, animals can have diabetes, animals can have epilepsy or other conditions. Like, it's sort of, you remember your childhood dog, which was...
Never given anything.
Never sick. Pretty much, right? And now we have all this like, your Cavalier needs to be on a lifetime supplementation of tears, or you need to recheck your Husky eye pressure every time you see anything wrong, right? So...
and it's not because pets are getting sicker, it's just...
Because we diagnose better and we treat better. And sometimes your dog was one eye blind and you never knew about it, because it still saw with another eye, right? And we examine animals better, okay? Sometimes we find conditions which are not causing like, let's say, vision loss or some serious side effects, but it's causing some discomfort for animals, and we still try to fix those and get them better, etc., right? So their quality of life is better. For the myths, in ophthalmology, honestly, people don't have much opinions.
Okay, so they don't have their kind of preconceived ideas of it.
No, it's not so frequent that people do something.
Online, they have these ones, but I'm also like, I don't know if they're. I'm like, do people say this?
That's
true.
Right.
Red eyes always mean infection.
Yeah, I would say this because it's easy. Like you tell to people your dog has a uveitis, and they're like, UV what? Like nobody knows this, right?
Yeah.
Nobody experiences this, so it's really difficult to like, you need to explain these conditions to people. I would say red eye almost always means inflammation, okay?
Okay.
maybe not an
difference,
infection. Infection if you have a discharge, if you have some discharge from the eye, most likely that's rather an infection, normally people come and say, my dog or cat has conjunctivitis, and everything is conjunctivitis, okay?
Yeah.
So this is
as
what
far
I
as
hear.
they go with them.
Yeah.
Old dogs just go blind with age.
Yes and no. Okay. So all dogs, there is some changes within, there is a structure in the eye called the lens, right? And there is a condition called cataract, right? When the lens gets cloudy, let's say, but it's a pathological process. And there is a rather physiological process which is related to aging when the lens gets cloudy, but more like a frosted glass. Mm-hmm. In cataracts, it's rather white, it's like really, really dense white. And therefore, because lens is just behind your pupil, and pupil is the hole, which is like, opens and closes, basically, right? And because lens, which is behind it, gets white in cataract, animals can't see. But in the old age animals, the lens gets a little bit opaque, it's just changing
a little
bit glassy looking, like a frosted glass door, I would say, honestly. And yes, their vision is a bit less because of that, right? It's not fully transparent, but they don't really go like blind, right? It's just a reduction in vision, I would say.
That's another thing that people kind of misbelief. If they have an old pet, they're like, oh, he has cataracts. Like a lot of people kind of diagnose it themselves, like I'm here for the cataract check, but it's, as you're saying, like quite often not actually that.
No, it's actually, here's, you're right on point. This is one of the myths, I would say, right? Basically, again, cataract and the other condition called nuclear sclerosis, okay? Mm-hmm. This is completely two different conditions, and very often you tell somebody nuclear sclerosis, they wouldn't understand what even, are we talking about medicine, or a space, right?
Yeah, what are we talking?
It sounds very random, right? So it's not something we hear like as a word, right, or as a phrase. Again, nuclear sclerosis is the lens getting cloudy with the aging, which is okay condition. You cannot really stop it. There is some like supportive, antioxidants, etc. Not really effective in my view, but they will see, and they will probably, it will get a little bit hazier with the age, but they will see throughout their life most likely. And very often you see animals coming from GPs sometimes also, because this is very like ophthalmic, you need to look inside the eye to understand, is it cataract or nuclear sclerosis, because it's behind your colorful part of the eye, right? The structure is. So basically, cataract is pathological. Cataract requires surgery. Cataract is more serious condition, right? It's not really something you can normally live, the whole life with, because it can cause problems in the older age. Nuclear sclerosis is normal. You can live with it. You don't need to do anything, too much about it. And if you come for an ophthalmic check, just to make sure, you come with your old pet and you're like, can you just have a look at it? Like, do I have to do something with it?
Is it the kind of normal glassy eye or not? Okay.
Exactly, yeah. But sometimes, you might notice it in people as well, because I'm pretty sure the same exists in people. In children, in teenagers, in young adults, you would see the look is like sort of very black, right? Because the pupil, like it's a bit more pronounced, because the pupil is like the lens behind your pupil is transparent, right? Mm-hmm. So it looks blackish, but because once the lens gets cloudy, it gets a little bit
staring
glassy.
At your eyes now, trying to.
I'm not so old yet, okay? But it's okay. It's a part of life. Okay, what can we do?
A lot of other people will kind of have an older pet and like, I don't know, is he going blind? Like he's not hitting himself on the wall. But is there a way people can check? Because they kind of just try and like, okay, we can see, like what's in humans. Obviously, we will go and you have to read, and we can assess their level of like sight. Do we have something similar for pets, or it's kind of all or nothing? Like,
you can do some stuff at home if you want to try.
Okay, tell us what you can do
try
at home.
Okay, there are a couple of ocular reflexes you can check at home. One is the Minas reflex. It's basically when you take an object or a hand and you kind of put it in front of the eye from the side, but without like creating an air,
right?
Because the air also affects,
it's
right?
It's going to be a different answer. Yeah.
So if you do it really slowly and your pet closes the eye, this is one of the very basic reflexes to check. If something comes to an eye, you naturally will close it, right?
So this the lack of closing the eye would be
but you do it slowly, sort of something like this, and you do it in cats, you do it in dogs. In cats is more difficult, definitely. In dogs is quite crystal clear, to be honest. In dogs, I never have doubts. In cats, sometimes they're just like this,
Yeah, I have one cat. It's just always staring.
Exactly. It's a little bit harder to do it at home in cats, but you can try.
Okay. What are the others?
Another one, you can check something called dazzle. It's basically when you put a light source to the eye, the animal is supposed to close the eye or at least twitch the lid, right?
Okay.
And you would switch off the light in your room, let's say, or you will take your cat or a dog in the bathroom where it's a bit darker, and you take a torchlight or flashlight on your phone, hide it, and then quickly kind of pop it out, right? And
so quite quick. Okay.
Yeah, and put it in front of the eye, and you need to watch the eye at that moment, right? If you see any twitching and the animal is closing the eye at that particular moment, this is also one of the positive signs that your pet can see in that eye. And the third one is it's not 100% guaranteeing vision, but most likely your pet can see if it has, because there is some also neurological patterns related with the eye reflexes, okay? But we'll not go, all the way. Yeah. And the third one, which is, I would say also very easy for people to see, again, dark room, flashlight. In dark, our pupils, they dilate, right? And when you put a light source, they constrict. And normally if you put the light to one pupil, the other one will constrict in the same time, right? So you can check pupillary light reflex. So basically dark room, flashlight, open your cat eye, try your best to do it with two hands, right? Not get bitten in the meantime, right? And put the light to the eye and you will see pupil from wide open will get shrinked. In cats, it's gonna look a little bit like, how to say?
Oh, the little slit.
Yeah. And in dogs, it's just going smaller but round, okay? So yeah, basically you can try to do these things. It's very, very basic. And it's easy, and it's non-invasive and it doesn't require anything. So you can test it at home.
I will go try them too.
Yeah, try.
And then the other idea that people have is, or I don't know, you'll answer if it's true or not, but if the dog goes blind, like, do they have the good quality of life still? Or are they struggling? Or the cat, let's say?
Because these days, most animals are indoor, right? Very rare, like, we don't keep dogs outdoor much these days, So most of dogs, they either go out for a walk, or they have a garden and a nice, like if it's a bigger dog, people tend to get a house with a garden, which they know already. So most cases, they spend at home, regardless, right? And home, they know, right? They already learned it. So I would say even if your animal is blind, they're doing pretty well. I have this client of mine, super nice guy, and he has this very rare dog breed called Vizsla. I don't know if you know them. Yeah. They're super nice, beautiful dogs, And he been extremely unlucky because two of his three dogs are blind, completely blind.
Wow.
Because
all
they
Vizslas,
have,
are they?
All
Vizslas?
Yeah.
Okay.
So Vizslas and their siblings, okay? So they have some genetic condition which caused them blindness. And they relocated from Singapore and Spain before to Dubai. And apart from being blind, also they have glaucoma. And glaucoma is elevated pressure. And we remember that when the liquid accumulates in the eye becomes bigger. It's really painful for a dog. And apart from being blind, the dog is also in pain. And we just had to actually put a prosthetic eye, in one of his dogs to remove the eye because we cannot control pressure. The pressure wasn't getting under control. And anyway, the eye is blind already for years. So these two dogs do really well. I see them in consult. I see them in clinic.
What's the benefit of a prosthetic eye?
Interesting. Prosthetic eye is very new to us, okay? And I will first explain what it is because people don't quite understand.
Oh, wait,
that.
Sorry. I think you didn't finish your last point about the...
Yeah, yes.
Sorry, finish that one first.
No, look, for me, blind dogs and blind cats do fine, okay? Because I see a lot of animals. I have a cat with one eye, all right? And that one does really well, but it has, half vision. And I saw a lot of blind animals, blind cats, blind dogs. I saw them in their natural environment in the house, of my friends, etc. And I saw them in the clinic, and normally they do well. They're a little bit more scared in the new environments, because they don't know it.
Well, that's what they say. They're like, don't move your furniture. Like, they'll kind of be able to know where the bed is to jump on, jump off, and live their life, but just stop rearranging everything.
Yeah, and obviously, like, if you move the house, it's going to take them a little bit of time. And there are some, like, devices to help them to assist.
Yeah, you've seen these halo bands? Yeah. Would you recommend these?
You can try. Not all animals are okay with the stuff being put on their head. And, most of them, they will still figure it out by smelling, by just experiencing the space they're in. You can try, small things. Some people put some like noise centers, for example, you have another
was
cat.
here last week and she was saying you can put this kind of like, I don't know, lavender, but some kind of smell to like the areas, their bed. Is that what you're saying? Yeah.
You can do this. Also, for example, if you have other pets, you would put like a little bell, right? So your other cat knows that this cat is coming, right? And this sort of things. And it's a really nice, sort of, just as we would say, it's environment modificators.
Yeah,
right?
exactly.
Okay. So we can do that.
Moving on to the prosthetic eye.
Prosthetic eyes. Basically, sometimes we cannot save the eye, or the eye is already blind, and let's say blind and painful. And there's no point to keep for life and keep this animal with a lot of pain in the eye.
And a lot of people, I think, are quite nervous. Like the eye's lost its function, or like at this point, like he can't see regardless, but they have like a bit of resistance maybe to like, I don't want you to, it seems very, dramatic to remove the eye. They don't like the concept.
They don't like the concept. I agree with you. But would you want to live in pain?
Yeah.
With like no vision?
And I can't see regardless.
Yeah. Imagine you have a tooth which is like dead and it's really like hurting you, for example, for whatever reason, but it's not like serving the function. You would want to get it out, right? Regardless. Of course, in people, it's a bit different because we apply this experience on ourselves. Like, like I wouldn't want to live without an eye, for example,
but it's more of an aesthetic.
But it's more like pets don't really understand this, right? They don't know, do they have real eye, but they know they have real pain, right? Yeah. So sometimes we are in the situation where we have to do it, right? Regardless whether we want it, we don't want it, this is the right choice. And normally we try to explain it to owner from the perspective of animal, because in a way, sort of owners supposed to be advocates of their animals, right? But sometimes you have
your
to
emotion get mixed up in it a little bit, or like how you feel about it.
And you're like, this is a surgery, I'm a bit concerned, or if it's an older animal. But we've done many so far in this clinic, and honestly, of course, obviously, not all animals are eligible for prosthetic, all right? I have to say that as well. Sometimes we have to fully remove the eye as well. That's sometimes just a better option.
What is the value of the prosthetic, though?
Okay, prosthetic is not like we are putting a new eye in your animal, right? It's just a rubber ball, which is basically you do a cut on the eye, remove whatever is inside, the structures, and you put this rubber ball and close the eye back, right? It's just to keep the eyeball as aesthetic.
Right, so it's just for aesthetic purpose.
Yeah, okay. It doesn't have any sort of practical vision or anything like that, right? So I have a client here in actually downtown. It was a husky, unfortunately, and it was a husky with glaucoma. And the client is really social guy. The dog goes out all the time, and he didn't want to have questions asked why the dog doesn't have an eye, etc. And we decided for prosthetic, and we put on prosthetic eye. It looks really similar to original eye, very, very similar. A little bit color difference,
Huskies have the two colored eyes.
Yeah, exactly. Yeah. So it's quite natural for the breed. And, he just doesn't want that social, kind of, like it's a little bit difficult socially, right, to answer every time the question, what happened to your dog eye? What happened to your dog eye? So he went for prosthetic.
And in your professional opinion, can that give side effects as well? Or like that could irritate them? It's better just to remove it? Or it's like it'll be the same either way you remove it, you put this?
You need to know that there is no way back, right? You cannot remove and then put prosthetic, right? So, for example, if the eye is diseased for whatever reason and it cannot stay and the structures are not functional, we decide to go for prosthetic, for example. And if prosthetic, for whatever reason, doesn't work for that animal, let's say, every surgery has complications, like potential complications, let's say it this way. Not necessarily they're going to happen, but they might, right? Prosthetic has really low rate of complication in my experience. Honestly, with the dogs we've done so far in the past 2-3 years, I've seen none of the serious complication, thanks God, right? And if you don't like prosthetic or it causes complication, you can always remove the eye. But if you remove the eye, you cannot put back prosthetic, right?
Sure, right.
So for me, prosthetic, if you want aesthetic look, right, it's much nicer. It's much nicer aesthetically, right? But cost-wise, there's no major difference, by the way, between removal.
Yeah.
Like, honestly, less than probably 20% difference between removal and putting a prosthetic.
I can see the appeal then if it's like pretty much the same price. Yeah, okay.
Yeah. But not done in cats,
Why is that?
In cats, generally prosthetic eyes don't work, and in cats normally
because they don't tolerate it, or
due to some difference like in the eye structures, I would say in cats we normally go for full removal. Okay, we don't really put prosthetic. It's normally done for dogs only. But honestly, you've seen probably many cats, right, in your practice as well, where they have like one eye only, or let's say stray cat, right, which they picked up and the eye already licked out, and they want to remove the remaining and close the lid, right?
Yeah.
And they live fine life. One eye vision is, is fine. You can live good life.
On the topic of new medicine and kind of advances we're making, what other kind of advances are you excited about in the ophthalmology world? It's a vague question, but
a lot of things happening always, right? In ophthalmology world, what's new? I mean, a lot of new, right? A lot of new, from small to big, There are new medicines appearing, new treatment techniques we're implementing, in common causes, let's say, right?
Well, this is kind of like a point that you were saying about earlier, like kittens are always kind of coming up with these eye problems, and most commonly for a very long time, as we're saying, the medicine is evolving, like steroids are always used for kittens with eye conditions.
This is killing me. Okay, never use steroids in kittens. Okay, try to avoid any ocular steroids in kittens, because steroids, again, cats, young cats and kittens mainly have viral problems. Okay, if you didn't get it checked at the vet, do not buy some random, steroid eye ointment because your friend used it or because your dog 5 years ago used it, right? Because in most viral cases, it really causes huge issues up to the point that we have to remove the eye. Wow. Okay, so in kittens, let's say you picked up a cat on the street, right? It looks a little bit watery, a bit gunky. It's always safe to flush the eye with saline water. You can buy normal saline in the pharmacy, while you're waiting for appointment with your vet, let's say, right? You can put a collar if the animal is itching the eye, right? But in kittens, never use steroids, okay? This is like a rule 1 of ophthalmology 101.
Don't do this.
Yeah, definitely. It's always safe to buy some lubricant, right? Like a normal hyaluronic acid lubricant, or artificial tears, saline water, and clean and apply lubricant. This is always safe. You're not going to cause worsening of any condition by doing that. But of course, it's better to be seen by a vet, because sometimes there is an ulcer you have to treat on the cornea, and you cannot see it with the naked eye. You have to do some tests for it. So this one we don't use. Okay.
And you kind of mentioned it already, but what are the simple kind of ways that owners can, like a take-home message for owners when you're talking about eyes, things you can do at home or things you should not do at home, such as giving steroids to this kitten you found on the street?
Okay. So first, remember that all the eye medicines, drops, ointments, once open, they are normally only good for 1 month, okay? You cannot use what you used 3 years ago.
So many people are like, this stray cat I found 4 or 5 years ago needed eye drops. Let me just give this to my dog, because his eye looks like, yeah.
Yeah, but don't do this, okay? You can maybe... and again, you don't know what you're treating, right? If there is, let's say, an ulcer on that cornea and you put steroid on it, you're gonna make it worse, right? So it's always safe to only clean and put lubricants, okay? The rest is not really safe, Sometimes topical antibiotic is also okay, right? If there is a discharge, you can use something very basic from topical eye drop antibiotics, but no more than that. No steroids, no drops from your friend, etc.
Yeah.
Or my neighbor had a dog, this is what they use, and I used it. Don't go that way, okay? So no old medicine, right? Nothing open more than a month should be used on a new issue, let's say we have. Don't use medicine you don't know, okay? Because you can make it worse as well. It's always safe to clean, flush with saline, or some Optrex, which is the eye cleaner, normal eye cleaner. And put a collar so they are not itching, and then see your vet and see where it goes from there. Sometimes it's really good idea to make a photo before, to be honest, because sometimes owners come and they already cleaned up the eye really nicely, and they're like, no, there was a lot of discharge in the morning, but I don't see it anymore, So sometimes it's a good idea to make photos, but when you do make photos, please don't make it in the corner of the room.
This blurry, dark photo.
Because I don't really see anything. I normally recommend...
You're quite a professional now at taking eye photos, so how should owners take these photos at home?
most of us have very good cameras these days, which can do macro. They're really good. I know it's not easy to keep a cat, let's say, or a dog and make a photo in the same time, but you can try. Normally 2 people job, to be honest with you, because somebody needs to hold an animal, somebody needs to take a photo. But sometimes you can manage better. A very important thing is the light source. You need to put some sort of light source towards the eye to little bit, to give a light to the eye, because I cannot see in the dark, right? Normally what we do, we use one phone flashlight, put it to the eye, and with another phone we actually making a photo. You can use a flash as well, but it's a little bit more difficult with the flash because animals also blink more.
Yeah.
But you can try that and try to do as close up as you can, but close up, I mean like here, not from 3 meters, because it's really difficult to see. We can attach some photos in the video if you want, like how I would want it to see. Yeah. And sometimes, for example, with the clinic, you can send a photo and say, look, I cannot come today. Is this an emergency or no? And if your photo is good, I will tell you if it's an emergency or no. And then we can decide, if really it looks funny,
I'm laughing. I'm just, people always send like the blurriest photos and like, my cat's like this. Is this an emergency? And like, you cannot see anything.
I want to help. I honestly want to help, and I don't mind looking at the photo and saying, because really, what if it's an emergency and I can save even one dog or cat vision, and I'm already going to be happy,
Of course.
So in general, I'm very happy to look at those pictures and say that, look, this one is urgent, this one is not urgent, etc. But the pictures need to be good, okay? But I understand it's not easy, okay? I know animals, and even at home with my own animals, I struggle when we are alone, right? In the clinic, I have an assistant.
This is definitely a 2-person job, yeah.
Oh, yeah. But, try your best, and I will try my best to help you, okay?
And to wrap it all up, do you have a favorite success story where eye treatment truly changed your pet life?
I mean, definitely Winston. You remember Winston?
Yeah, obviously.
His, sweetheart, right? No, of course. But we had a lot of cases as well. We had another very, very sweet doggy. He had diabetes, and diabetes causing cataract very often, and cataract need to be surgically repaired. Yeah. So this dog, because of cataract, because the lens and the eye got cloudy, he went blind completely. And he's like the happiest, fastest dog in the world, And he's running, but because he got gradually blind, he's already a little bit struggling with all this activity he had. And sort of owner brought him in, it's 10 or 11 years old at the time. And they were a little bit reluctant to go for a surgery, to fix the cataract, right? So he can see again because of the age, and they were scared of his diabetes. And in the end, we agreed to go ahead with it, and we did. And that moment when he wakes up from anesthesia and he realizes he can see again. I had a goosebumps. It's super sweet, honestly. I want to cry.
You're actually tearing.
I know. It was very sweet, honestly. I really enjoyed this case, okay? And, you have a lot of nice cases. Sometimes it's just removing pain from animals like those Vislas, with the glaucoma. Sometimes it's regaining vision, it depends on what you do.
So rewarding, and I think
it's
like one of those things. If you come from the start and you kind of follow the advice, you can get really good results, and there's so much you could do.
There's so much we can do these days, honestly, and I'm very happy. Sort of level of care increased so much in the world.
Yeah.
In modern vet, we had grown so much lately, and in terms of like ophthalmology, a lot of other fields of medicine, we're really good, and I'm really happy about that, because basically it means we can. Maybe on the big scale it's difficult to see, but when you think of this individual cases...
Yeah, like if you came here a few years ago, that eye would be out straight away.
Yeah, exactly. Yeah. Or you would be, sad that nothing can be done, okay? Yeah. Of course, not every story is success, okay? But there are a lot of good ones, and we should work for those, and we should try to help as much as we can.
Of course. Thank you so much, Dr. Tatiana, for joining us. And for everyone listening, please let us know if you have any questions for Dr. Tatiana. She will definitely answer everything you have to ask her. And just let us know in the comments whatever topics you'd love for us to speak about. Thank you, everyone. Thank you for coming.
Thanks so much.
Was you crying at the end?
I remember this song. It was very sweet.